Well, I think the key importance is to, number one, for patients to realize that there's a group of very dedicated healthcare providers who want to see things advance. And from a patient perspective, I imagine knowing that there's a community of people who are in the same situation they're in, and the opportunity for us to, in a very informal way, meet them, speak with them, interact. It breaks down some of the traditional barriers, particularly from a patient-physician standpoint. So I think great networking, great opportunity for us to demonstrate our commitment to their care, and also great opportunity for them to really understand that we have the same goals that they do.
Mm-hmm. And in terms of the American Brain Tumor Association, the ABTA, how do you use them as a resource in the work that you do?
So the ABTA has been really great. A lot of the educational materials that we provide to our patients at my place at M.D. Anderson comes from the ABTA. We often give the ABTA contact information to newly diagnosed patients. They find it very comforting, a resource for education. One of the things that I am involved with is a rare brain tumor called ependymoma, and we've actually formed a collaborative effort with the ABTA for educational outreach. They receive a lot of folks from all over the world asking for information, and by doing that, they're leveraging our expertise in a rare disease, but we're able to leverage their resources. So it's a win-win situation. So that's the type of spirit. Their goal is to help patients. Their goal is to provide education, and so it's not a competitive. It's a completely collaborative, collegial opportunity. So I see the ABTA as absolutely a critical resource to patients and actually to healthcare providers. And they've also are an important part of our research mission, providing research support, particularly from the young investigator standpoint. I think a lot of the people who have made some of the important discoveries in brain tumors came through the ABTA process of getting their first grant, which really stimulated a career in research.
Mm-hmm. And in terms of research, what do you see as the future? Detection?
So I think that the answer to that is we don't know, because it's the future, but I would put my money on the integrated personalization of care. And what I mean by that is when we treat a group of patients and we see a response rate, what that tells me is that there is a subgroup of people who have benefited, and then another group of patients who have not benefited. And if we could interrogate why certain people benefited and others did not, then we could ultimately define who should get that treatment. So if you have a treatment with a 20% response rate and you can identify that 20%, now it becomes 100% response rate. So how do we get there? And I think it's an amalgam of looking at the tumor, but there's also a component that we've not really spent a whole lot of time in, and that's actually looking at the patient at both clinical factors and genetic factors, which would tell us that this patient is going to be one of the people that tolerates treatment well or doesn't tolerate treatment well, somebody who we need to adjust the dose of the therapy. So you can find the perfect drug but not know how to dose it, and either cause harm or underdose that patient and not get the true benefit. So it's going to be an amalgam of clinical factors, the patient's own genetics, and then looking at tumor genetics and combining all of that to really come up with a personalized treatment. That's what I see the future is. It's going to require large-scale integrated efforts, and I think some of that is going to come from grassroots organizations. It's going to come from patients lobbying for the kind of support it's going to take. And I think we're beyond just doing a clinical trial where you take a group of people and give them a drug and say, this is how we're doing. It's going to require multidisciplinary, broad-scale, integrated efforts. If you think about how complicated the genetics are, and then think about doing that across 400 or 500 patients, it's going to require a lot of work. But otherwise, we're going to be mired in what I think is slow advance as opposed to major improvements.
In your community, though, it seems like you guys all keep in touch. I mean, is it true, or is that just put on for this event?
No, I think it's a very tight-knit community. I joke and say some of my best friends are neuro-oncologists, but it's true. And I think one of the really heartening things is that it's not just country-based. So I have very close colleagues, collaborators, and now friends in Europe and Asia, folks that I look forward to meeting at going to meetings and getting together with. Wouldn't hesitate to pick up the telephone, send an email about a collaboration. In fact, a clinical trial that we did starting in 2006 was an international collaboration. And so about 20% of the patients actually came from Europe. And they were integral parts of development and the effort. And we wound up actually accruing almost 1,200 patients in a little over 2 years because of that international collaboration. We're now collaborating on the research that has spawned from that. So I really see the future as being productive, collaborative, and not in the ha-ha way, but fun. I mean, it's fun, it's enjoyable. There's a camaraderie that makes it a lot easier to think about the task in front of us.
So you don't have to say anymore, if I have a brain tumor, I want to be in Germany. That's what I always used to think. That's the place that, if I was going to have a brain tumor, I hope it would happen in Germany. But now I don't have to say that anymore.
There are lots of places in the world that you can go and get outstanding care.